All right, everyone. Welcome. It's so good to have you. Hopefully, you all can hear me. All right. It don't look like you can see me. I don't know if I lost my camera or not, which is strange. Let me see if I can get it back up in here. Camera. Are we locked? Hang on with the camera. Oh, 1 second. Let me get my camera straight. You acting like you don't want to do it. All right, I do not know why, but for some reason that camera's not working. I have to use a backup camera, so I do apologize. Now we are good. All right, and so I'm looking forward to that. It's going to be super exciting. All right, and for those of you that are with us tonight, I know it's this evening where you're with your family and so forth. So therefore, I don't know who's going to show up, but those that do, you're going to get something special. And if you're sitting with your family, they're going to get something special as well tonight. Okay. So we're talking about lung cancer. And so tonight we're going to go over the symptoms of lung cancer, the causes of lung cancer, what lung cancer is, and how to be able to allow your body to heal lung cancer. Okay. So it's very important that you pay close attention as we go through this. If you have not watched my previous cancer video, it'll say cancer. I go in depth into cancer. So all forms of cancer are linked to that. And so therefore you need to watch that video before you watch any of the other cancer videos. From there you can watch any of them and you'll be pretty good on a specific type. But I would advise you to watch the cancer video on our Patreon, patreon.com/health class, all one word. Go there and make sure that you sign up. At least any tier will do, and you better watch the whole videos. And that video right there, the cancer video, is a long video, but it's very, very important that you get that information for before you watch these videos, because I do not go back through that information. Okay, so make sure that you do that. So again, if you have not subscribed, please make sure that you do subscribe. Okay, make sure you subscribe to our channel. It's going to help us. It's going to help us, and then B, it's going to help you be able to get the information that you need when we go live. It's going to notify you. It's going to also allow you to be able to chat in the group, so you'll be able to chat as well. Okay, so it's important that you definitely do that. So lung cancer is a malignant tumor. Okay, so that's the first thing that we start off with. All right, is understanding that lung cancer is a malignant tumor. Before I go into this class, though, I need to play the disclaimer to make sure that you all have the information as far as the disclaimer, and then we'll continue.
Disclaimer. The information contained in this video is intended as an information resource only and is not to be used or relied upon for any diagnostic or treatment purposes. The video's information does not create any patient-physician relationship. Dawood Yisrael makes no representations about the accuracy or suitability of this content, as scientific and medical information updates and changes daily as more substantial information is discovered. Dawood Yisrael and any business associated during this video shall not in any event be liable for any direct or indirect damages, losses, injuries, or liability whatsoever suffered as a result of your use or misuse of this video's content. Use of this video is at the viewer's sole risk.
All right, everyone. So we're jumping right into the class today. Okay, so lung cancer is a malignant tumor that starts in the lungs, usually in the cells. So it's a malignant tumor. This is the first thing that we notice about lung cancer. It is definitely malignant. Okay, that's a very important point. What does that mean? That means that it is volatile. Okay, that means that it is running rampant. It's doing what it wants to do. All right, in your system, and we don't want anything doing what it wants to do in our system. So lung cancer is volatile. So if anytime that it's malignant, that means it's very dangerous. Okay, that starts in the lungs. So it's a cancer that's malignant. or malignant tumor, right, that starts in the lungs, right? And a tumor is what? A group of cancer cells, okay, that starts in the lungs, usually in the cells that line the air passages, okay? It's the leading cause of cancer deaths in the United States, accounting for about 1 in 5 of all cancer deaths. And if you understand, if you go watch the video on cancer, you will understand why that makes sense. Okay? Why would this be the number one cancer causing uh or form of cancer? Why? And if you go watch the cancer video, you will definitely understand why that would be, okay? So, symptoms: cough that won't go away, coughing up blood, breathlessness, chest pain, hoarseness, unexplained weight loss, loss of appetite, bone pain, headache, swelling in the face or neck. Okay. Smoking, risk factor: smoking, secondhand smoke, exposure to radiation, to radon, or asbestos, as well as radiation, exposure to other cancer causing agents in the workplace, taking certain dietary supplements, right? Arsenic in drinking water, previous radiation therapy to the lungs. Lung cancer can be spread to lymph nodes or other organs in the body. This is a key point. Lung cancer can be spread to lymph nodes. Whenever cancer gets in the lymph, it becomes extremely dangerous. Okay? Now it can go to other organs. It can go all over the body, such as the brain. And it will go to the brain because now it's going to go into your glymph system. This is why you need to watch the video on the glymph system and how to cleanse your glymph system that I did, right? Make sure you do that. The stage of cancer tells you how big it is and whether it has spread. The type tells you which type of cell the cancer started from. The number of new lung cancer cases. This is a key point here, right here, and I love this. This is a good thing. The number of new lung cancer cases and deaths continues to decrease. This is powerful, partly because more people are quitting smoking and advances in early detection and treatment. And for those of you that might be younger, I want you to really understand something that's very powerful that I'm going to share, and that is this. Lung cancer, or cancer, basically all cancer, you could smoke everywhere in the United States. In other words, you could smoke anywhere. And secondhand smoke, let's say you didn't smoke. Secondhand smoke they said was more dangerous than the person smoking. So people were getting cancer that didn't even smoke just because they were around smoking cigarettes, right? So if you notice people haven't been smoking as much, especially in public places, because now it's illegal to smoke in public places. This has caused the cancer deaths to go down. But when they learn to get rid of allowing asbestos, radon, and those type of things, when they learn to get rid of that, then you're not going to have the cancer cases that you have today. The microwave, like I said, should be illegal itself, right? On every level. Because when you put the food in there, you're changing its DNA. It becomes a carcinogenic item, and now you're eating it, right? So you're taking it in your body. You are what you eat, basically. And so therefore you're going to have a problem. Okay? So we don't want to have problems. We want to win at this, okay? So we keep moving. And that's what we want to do. This is a good thing. Now, with that law, that one law makes a difference between how many people are dying from cancer. And I'm glad to see that. We always support the positives. We always support the positives, no matter where it comes from, right? We always support the positives. Now, there are two types of cancer, okay? There's lung cancer, There's two types of lung cancer. There's small cell lung cancer, known as SCLC, is an aggressive, fast-growing type of lung cancer that starts in the lungs, airways, and quickly spreads to other parts of the body. Okay? This is the small cell lung cancer. That's one type. The other type is called the non-small cell lung cancer, NSCLC, and is the most common type of lung cancer, representing the majority of lung cancer. So most people have NSCLC. Okay? Most people have that. Welcome, welcome, welcome to our beloved Jerry. Welcome. So glad to see you tonight. So, again, it is the most common type of lung cancer, representing the majority of lung cancers, and refers to any type of epithelial cancer that is not classified as small cell lung cancer. It usually grows and spreads more slowly than small cell lung cancer, and the main types of NSCLC include adenocarcinoma. Okay, so adenocarcinoma is the number one, squamous and cell carcinoma, and large cell carcinoma. Okay, so these are those are the two types of cancer, right? Small small cell lung cancer and non-small cell lung cancer, and the majority have non-small cell lung cancer. Okay, but that's what the majority have, which is a good thing. All right, now symptoms of lung cancer, right? And I went through these, but I'm gonna go through them a little bit more thoroughly. Okay, so coughing, a cough that doesn't go away or gets worse, especially at night. Chest pain, pain that worsens when breathing deeply, coughing, or laughing. Shortness of breath, persistent breathlessness, right? And this can also be a sign when you have the shortness of breath, this can be a sign of congestive heart failure, okay? Weight loss, unexplained weight loss, okay? Not if you're on a diet or you're eating right now and you've lost the visceral fat or you're working out or something. This is just weight loss that just shows up. This can be a sign of cancer, or it can be a sign of type 1 diabetes as well, which, as we explored, remember, they can work hand in hand, right? Coughing up blood or rust-colored sputum, right? Hoarseness, a new onset of hoarseness. Fatigue, feeling very tired all the time. Infections, frequent lung infections such as bronchitis or pneumonia. And a new onset of wheezing, okay? Now, if you are obese, like if you become obese or you're eating the wrong foods, you can wheeze. You just want to make sure that that you're paying attention if it's long term. Okay? However, many people with lung cancer don't have symptoms until the disease is in its latter stages, meaning if these symptoms show up, they're going to be serious symptoms. They're not going to be lightweight, because they're not going to show up until the disease is in its latter stages. This is because there are few nerve endings in the lung, so a tumor could grow without causing pain or discomfort. Okay? Just be clear on that. So how you're eating is going to be key. Now, smoking. Cigarette smoking is the number one risk factor for lung cancer in the United States. Cigarette smoking is linked to about 80 to 90% of lung cancer deaths. All right? So that should tell you what? Get rid of the cancer sticks. When they call them cancer sticks, that's literal. It's not figurative. So if you're smoking for any reason, you need to get rid of the cancer sticks. Okay? Now, cigarette smoking is the number one risk factor for lung cancer. In the United States, cigarette smoking is linked to about 80 to 90% of deaths. Using other tobacco products such as cigars or pipes also increases the risk of lung cancer. So you want to quit smoking. Our body is not designed to ingest cigarette smoke. As a matter of fact, it cuts off the spirit, right? Cigarette smoke cuts off all smoke. Any smoke inhaled into the body cuts off oxygen to the body or to the brain. All right? We don't ever want to cut off spirit to any part of the body. So smoking is not something that you want to do. All right? That's not the way that you want to heal. You want to find other modalities that allow you to be able to heal without smoking. Okay? Now, tobacco smoke is a toxic mix of more than 7,000 chemicals. Now, we definitely don't want to put that into our body, right? At all. Many are poisons. At least 70 are known to cause cancer in people or animals, right? People who smoke cigarettes are 15 to 30 times more likely to get lung cancer or die from lung cancer than people who do not smoke. 15 to 30 times. Even smoking a few cigarettes a day or smoking occasionally increases the risk of lung cancer. The more years a person smokes and the more cigarettes smoked each day, the more the risk goes up. People who quit smoking have a lower risk of lung cancer than if they had continued to smoke, but their risk is higher than the risk of people who never smoked. Quitting smoking at any age can lower the risk of lung cancer. Okay? And I got all my oxygen back when I quit smoking. That was a great blessing. Now, cigarette smoking can cause cancer almost anywhere in the body. Cigarette smoking causes cancer of the mouth and throat, esophagus, stomach, colon, rectum, liver, pancreas, voice box, or what they call the larynx, lung, trachea, bronchus, kidney, and renal pelvis, urinary bladder, cervix, and acute myeloid leukemia. Okay? So it causes all of these cancers. Cigarette smoking alone. Smoke from other people's cigarettes or pipes or cigars, secondhand smoke, also causes lung cancer. So you don't want to be in the midst of those people. All right? Your environment is key. How you deal with and those you deal with and those you're around is key to your life. All right? So you don't want to be around cigarette smoke. You want to be as far away from it as possible. Okay? Indoor radon is another important cause of lung cancer in the United States. Radon is a naturally occurring gas that forms in rock, soil, and water. It cannot be seen, tasted, or smelled. When radon gets into homes or buildings through cracks or holes, it can get trapped and built up in the air inside. People who live or work in these homes and buildings breathe in high radon levels. Over long periods of time, radon can cause lung cancer. The risk of lung cancer from radon exposure is higher for people who smoke than for people who don't. But radon can cause lung cancer among people who have never smoked cigarettes, okay? Now, other substances. Examples of substances found at some workplaces that increase risk include asbestos, right? Arsenic, diesel exhaust, and some forms of silica and chromium. For many of these substances, the risk of getting lung cancer is even higher for those who smoke. Living in areas with higher levels of air pollution also increases the risk of getting lung cancer, right? Now, if you are a lung cancer survivor, there's a risk that you might develop another lung cancer, especially if you smoke. Your risk of lung cancer might be higher if your parents, brothers, or sisters, or children have had lung cancer. This could be true because they also smoke, they live or work in the same place where they're exposed to radon and other substances that can cause lung cancer, or because of an inherited genetic mutation. Okay? Cancer survivors who had radiation therapy to the chest are at higher risk of lung cancer. And diet. Scientists are studying many different foods and dietary supplements to see whether they change the risk of getting lung cancer. Now, this is very important. Scientists are studying many different foods and dietary supplements to see whether they change the risk of getting lung cancer. All right? There's still much we need to know. We do know that people who smoke and take beta carotene supplements have increased risk of lung cancer. Okay? Also, arsenic and radon in drinking water, primarily from private wells, can increase the risk of lung cancer. All right, so you want to be very careful with the well water. You need to get yours tested if you're using well water, okay, if you're watching this video. Now, the other key thing that I want you to understand and get is that they have not linked, and they'll always say this, that they have not linked diet to lung cancer. But it definitely is. That's why I need you to go back and watch the video on cancer if you did not see the whole video on our Patreon. It's very important to watch that, okay? Now, the next thing we're going to go over is what is lung cancer. This is an in-depth piece, but I dealt with what is lung cancer. What I want you to understand is how does lung cancer differ from between men and women in this article, and we're going to look at something else in this article. How does lung cancer differ between men and women? Oh, the stages of lung cancer. We're going to look at those. Lung cancer has historically been more prevalent in men, but the gap has been narrowing over the years. This is largely due to increased adaptation or adoption of smoking by women in the latter half of the 20th century. Okay? So lung cancer has historically been prevalent in men, but the gap is narrowing because women have been smoking those more squares, right? Or cigarettes, which that was something we should not be doing. Letting you know. As a result, the occurrence of lung cancer in women has risen. Okay, or smoking. They didn't say cigarettes, they said just smoking. As a result, the occurrence of lung cancer in women has risen, highlighting the importance of understanding and addressing this disease in both genders. Overall, the chance that a man will develop lung cancer in his lifetime is about 1 in 15. So for every 15 men, one is going to have lung cancer, according to their study so far. This is the reality that has been created in this season. For a woman, the risk is about 1 in 17, not much better. Black men are about 15% more likely to develop lung cancer than white men, while the rate is about 14% lower in black women than white women. Both black and white women have lower rates than men, but the gap is closing. The lung cancer rate has been dropping among men over the past few decades, but only for about the last decade in women. So that means less men are smoking now than were before. Who is most at risk at developing lung cancer? While anyone can develop cancer, certain factors can increase the risk. The primary risk factor for lung cancer is smoking, as we stated, with 80 to 90%. We already dealt with that. I'm going to move forward. Okay? Now, I want you to see this though. You can also develop lung cancer from breathing secondhand smoke from exposure to cancer causing substances such as radon, we talked about that. Asbestos, we talked about that. Chromium, nickel, radioactive ores such as uranium and plutonium, arsenic, vinyl chloride, silica, coal products, chloromethyl esters, diesel exhaust, air pollution, and soot and tar. All right. So the word you want, that's why you want to get to a point where you're living in an area that is around either you in trees or it's very rural. You want to be in rural areas, right? Get out of the city, as the scripture says. Get out of the city, right? Flee from the cities. Get out of the cities into the rural areas. Much better. Now, dealt with those already. And we're going to deal with these. There's two types of lung cancer. Remember, the small cell lung cancer, right? And the non-small cell lung cancer, okay? But now, inside of the one that the majority have, which is the non-small cell lung cancer, then there are subtypes. There's three of them, okay? The most prevalent. There might be more, but there's three that's the most prevalent, they're saying. The squamous cell carcinoma. This type of NSCLC, which is the non-small cell lung cancer, typically originates in the lining of the bronchial tubes. Okay, so in the bronchial tubes is going to be in there. All right, it is often associated with a history of smoking and is more common in men. Squamous cell carcinoma tends to cause symptoms earlier in the disease progression. Now, this is the most common one that everybody gets. Adenocarcinoma. Adenocarcinoma arises in the cells that produces mucus in the lining airways. Okay. It is the most common type of lung cancer in both men and women, and it often occurs in non-smokers or former smokers. Adenocarcinoma is more likely to develop in the outer parts of the lung. Okay, on the outer parts. Large cell carcinoma. This type of non small cell carcinoma tends to grow and spread quickly. It can appear in any part of the lung and is often associated with poor prognosis. Meaning, if you have it, their prognosis is that you're gonna die. However, as I stated, if you start eating the optimal liver, you can reverse anything. So now what we're going to get into is how to get your body to start reversing this, right? Or allowing your body to heal lung cancer. All right. So that's and more videos like these. You can join us at patreon.com/health class. Again, that's patreon.com/health class. And join one of our paid tiers. Any of them will do. And you join one of those tiers, you can watch the rest of these videos as well as all the other videos that I produced, including my former health classes, which is 4 to 8 hours of information that can help you on your health journey to the top. All right. So I look forward to sharing that adventure with you. I look forward to seeing you at the top of your health journey. Peace. For the rest of this video and more videos like these, you can join us at patreon.com/health class. Again, that's patreon.com/health class. And join one of our paid tiers. Any of them will do. And you join one of those tiers, you can watch the rest of these videos as well as all the other videos that I produced, including my former health classes, which is 4 to 8 hours of information that can help you on your health journey to the top. All right. So I look forward to sharing that adventure with you. I look forward to seeing you at the top of your health journey. Peace.